let's go back to the big story that keeps resonating in this country and bring in Laura Tamblyn Watts. She is the CEO of CanAge, a national seniors advocacy organization. She joins me now from Whistler, British Columbia. Laura Tamblyn Watts, good to speak with you again. Thanks for your time today.
Good morning.
I want to start by a number of things I want to walk through on the long-term care issue and these horrible findings we got from the military in these homes in Ontario. But I want to start by getting your reaction to the reaction of our political leaders on this, to this report on the horrible conditions. They're reacting as if all of this is news to them. What do you think of those reactions?
Well, it can't possibly be news to them. They've been getting consistent reports through this pandemic and for the years that they've been in power. And this is true in Ontario, this is true in Quebec, and across this country. There's nobody who should be surprised. They should be shocked and horrified, but they shouldn't be surprised.
Let me pick up on that. When you heard what was in this report from the military, were you shocked or surprised by what they found?
No, I wasn't, sadly, and that is perhaps the greatest indictment of all. And what's in the report is really compelling and difficult to read. We're talking about cockroaches. We're talking about people with flies starting to embed into their bodies. We're talking about people who are left in feces, people who are crying out for hours for help, people who are not being fed, or people who are being force fed to the point of choking. So these are not just sort of people aren't getting the showers as long as they might want. These are the basic necessities of life and a form of institutional abuse that had to be brought to bear by the military. If our Canadian military, who goes into war zones, is saying that this is shocking to them, it should be horrifying to everybody.
You mentioned some of the findings. Included in those findings, rotten food, COVID infected residents allowed to move freely among non-COVID infected residents, the reusing of syringes, poor training, people left in soiled diapers for days at a time. When you hear those kinds of findings, the military obviously observed these things. Clearly, other people must have observed them as well. And the suggestion is that this has all been happening because the homes have been pushed to the limit because of the pandemic. Do you believe that?
I do think that many homes are being pushed to the limit because of the pandemic, but they were already breaking before, and it's really a systems problem. We have been consistently not putting money where it needs to go, and we have been retreating away from our requirement to invest more money because of the age wave. We have staffing shortages across the board. We have been de-skilling the staff. So it used to be we had doctors and nurses in long-term care and a few licensed practical nurses and some PSWs. Now it's almost impossible to find a doctor who is in long-term care. And in some jurisdictions like Ontario, you may need only one registered nurse. PSWs, who are often wonderful people, are being pushed to the limit and being asked to do things that are unsafe. They weren't even provided with the protective personal equipment to keep them safe in Ontario. There were calls that we were helping to support for donations of PPE, like masks and gloves, from nail salons and hair studios. And if that's not an indication of a broken system and lack of response, I don't know what is.
Yeah, in fact, you talk about the doctors. That was one of the findings of the report, that often when doctors were supposed to be around, there was no sign of them. It's an incredible indictment of the way the system is. And I guess what I want to know is, and I'm going to get to the pivot point of where we go from here, and I want your thoughts on that. But this was an examination of 5 long-term care homes in the province of Ontario where the military was deployed. We're expecting a report this morning on the situation in Quebec. The suggestion there is the findings are not going to be quite as horrific as the ones we've seen in Ontario, but we will see. But this is about Ontario, this report. I mean, how representative is it of long-term care homes across the country?
Across the country, the systems are essentially the same. Now, there's some differences, and I do not want to be understood to say that I think that all long-term care is in this dire situation. There are wonderful long-term care homes, and there are great physical buildings in long term care homes, and there can be fantastic staff. But what we know is across this country, we haven't invested in staffing. In many jurisdictions, the buildings are old, and that's very true in Ontario and Quebec, where you still have rooms of 4 people divided by a curtain who may share bathing facilities, maybe 20 people sharing the same bathing facilities. In Ontario, we're going to lose about 30,000 long term care home beds out of 76,000 because they're not going to meet the sprinkler standards for fire codes within 5 years. So, these are not new questions. We've been talking.
All right, we have a problem. Oh,
In British Columbia, it pays its staff more and that the homes are better. In
uh,
some cases, the physical built environment is more modern.
okay, let's. I want to let the conversations now pivoting to what needs to be done, and no one can ignore what we've heard from this report and what we might hear from the one in Quebec. But I think the great fear is that there will be a long, drawn-out process to get to change. What needs to be done right now?
Right now, we know what the recipe for change is. We need to fix staffing. We need to have more staff, better paid in one site, and make sure that they get the same respect that they deserve in other jurisdictions. We need to make sure that the infrastructure gets renewed, and we need to change out of a medical model into an emotion focused model. We can do it. We don't need to wait for any type of commission.
Okay, tell me about that. What is when you talk about changing from a medical model? What do you mean?
So if you think about kind of that typical nursing home environment where we're thinking about a big building which has got significant people sitting around not moving, there are people in uniforms everywhere. It looks like an institution. By contrast, what we're looking to have are small homes, maybe 10 to 20 people, where no uniforms are being met. And people are really living a vibrant environment. Some people will call it the butterfly model or the Eden alternative. In the end, we know that it's safer and it meets the needs better of people with dementia. Right now in Ontario, about 90% of people have cognitive impairment who are in long term care. Our system wasn't built to support that population, but we know how to do it. We just have to actually invest and do it.
What role do you see the federal government? We're hearing a lot about that this morning in our coverage. What role do you think the federal government needs to play in the Prime Minister in this crisis?
Yeah, I think that there is a sense across this country that we can now no longer have this finger pointing between jurisdictions. This is obviously a problem that we have to work together as Canadians on. We would like to see at CanAge a national set of standards and in a body at a national level, which would be able to leverage fines of a significant note and hold some of the accreditation. That also could have a targeted pocket of funds, which would then be transferred from the federal government to the provincial government. We've done that before in lots of other areas, whether it's for hip surgery or knee surgery or HPV. We can do that. And that has never been done. I do think that the federal government has a leadership and a financial role to play, even though it falls within the provincial jurisdiction.
Right. And so we just heard the Bloc Québécois leader say, yeah, that's not on in Quebec. Send Quebec the money. Quebec will take care of handling the problem. That's the kind of resistance you're looking at in some provinces.
It is real. I mean, we're a country that has a division of powers, but I think when it comes down to it, it is a real indictment about what's been happening in Quebec. They were the first to call into the military. And when we saw things like Résidence Haron, where people were saying that it was like a concentration camp, I would push back against the Premier of Quebec and say, you called in the military for help. We need you to help with national standards so that we make sure we can fix long-term care across this country. It's time to be a partner.
So you're closer, it sounds like, to what the NDP leader is suggesting, that create a national, some kind of perhaps something similar to the Canada Health Act for long-term care homes, tie funding to standards and conditions and what the money has to be used for. That's where you come down?
Yeah, it's the Australian model. It's been working very effectively in Australia, who has that similar kind of division of powers that we do in Canada. And so we know that there are models that work very well. The question about whether or not long term care goes under the Canada Health Act is more difficult in practice than it is in thought. So there is this idea that, long-term care should all be non-for-profit. Whether or not we can do that now is a separate question. About 50% of long-term care is provided by for-profit companies, and we're already short of beds. So hard to know how we would transition.
Or at the very least, you'd be talking about years to eliminate that stock and move into, unless some people would suggest that, okay, if that's what everybody wants, have governments, buy out the private companies and then begin to run them as public operations. Is that a possibility?
Yeah, I think it is going to be a possibility. At this point, everything really has to be on the table. What we know that doesn't work is what we're doing right now. So, we hear people saying everything should be nationalized. I think that's probably unlikely. But key standards with funding tied to it, that's doable.
All right. Thank you so much for your time today. Always a great pleasure to get your perspective, Laura Tamblyn Watts from CanAge. Appreciate it. And we'll talk again. We'll continue to pay close attention to how this story unfolds and the way Canadians have sort of been galvanized for a demand for some kind of action here. Appreciate your time today.
Thank you.
Take care.